So I'm going to start with the introduction. Glioblastoma is a primary brain cancer which can arise anywhere within the central nervous system, occur most common in adults in the cerebral hemispheres. It also belongs to a heterogeneous collection of brain tumors termed gliomas, which are derived from the word glia itself in the glial cells or their precursor and include the astrocytomas and oligodendrogliomas. Next is sign and symptom. The first sign is high blood pressure. It occurs when the body raises the blood pressure to push blood through the compressed vessel to ensure oxygen is delivered to the brain. It can also lead to changes in the breathing rates. Due to the brainstem compression, breathing can become irregular, leading to the temporary apnea. Lastly is a papilledema, which is swelling of the optic disc visible during eye exam, often due to the increase in the intracranial pressure caused by the tumor cell. So moving on to the symptom. The first symptom is seizure. Seizure associated with the uncontrollable arm and leg movement and loss of the consciousness. The next one is a headache. The most typical manifestation for glioblastoma is a tension-type headache. Last but not least is nausea. As a brain tumor increases in size, it consumes more and more space within the skull, raising the intracranial pressure that makes patients feel nausea.
Next, I will explain on the axial plane of the CT scan. Figure 1 is shown an axial plane of the computed tomography CT scan. In this figure 1, glioblastoma is seen in the left frontal lobe, and it is visible on this axial CT scan at the level of the basal ganglia. As I indicated using the yellow arrow, we can see that the glioblastoma is seen at the area of the left frontal lobe. So usually on the CT scans, areas that appear darker than the surrounding brain tissue we refer as a hypodense. In this axial view, glioblastoma appear as a large hypodense lesions, which the central of the hypodense indicates necrosis. So how necrosis happen? Necrosis happen when our brain tissue does not receive adequate blood supply because of the growing of the lesions, or in this case, which is the glioblastoma, it grows very rapidly in our brain. On this image, we can see that the midline of the brain was shifted to the right region due to the mass effect that caused by the glioblastoma. So in the effect of the effacement of the ventricles, which is a loss of the normal structures due to the external pressure or displacement, the right lateral ventricles look to be slightly dilated, whereas the left lateral ventricles is compressed because of the presence of the glioblastoma on the left side of the brain.
Continue with the coronal plane in CT. Figure 2 is an image of brain in coronal plane of post-contrast CT, and this is a case of parafalcine glioblastoma grade 4 in a 30-year-old male. A high-grade glial lesion of glioblastoma is generally characterized by the presence of heterogeneous tumor tissue, patches of necrotic area, presence of infiltration into the brain parenchyma, vascular endothelial proliferation, and disproportionate vasogenic edema. There is an appearance of a large infiltrative lesion in the left parasagittal frontal lobe with associated mass effect. The internal area of necrosis, which is hypodense, appear darker compared to the surrounding tissue, and it is surrounded by vasogenic edema indicated by the white arrow, which appear as an irregular ring enhancement. The lesion is a dural base that attached to the falx and displacing it toward the right side. There is also an involvement of the corpus callosum.
This is the CT sagittal plane of the brain post-contrast administration. From this image, there is a finding of glioblastoma in the left posteromedial temporal lobe, lateral to the trigone of the left lateral ventricle. It showed up as a slightly hyperdense structure due to the composition of solid, densely packed tumor cells. This hyperdensity is also most likely due to the contrast enhancement. Next, there is a ring-like enhancement of contrast-enhancing tumor cells due to suspected blood-brain barrier breakdown. Furthermore, the glioblastoma is seen compressing the cortical and subcortical white matter in the left cerebral hemisphere. This compression causes an increased intracranial pressure, which may lead to various neurological symptoms. The left hippocampus, which is situated medially within the temporal lobe, is also directly infiltrated by the tumor cells. This can lead to short-term memory deficits or anterograde amnesia.
Hello everyone, my name is Nik Ainin and I'm going to continue our discussion for today. So after all the CT views, we're going to look at how glioblastoma looks like in different views of MRI. So I'm going to start first with axial view. So as you can see in the picture, the one that I put the arrow, there is a well-defined hyperintense or bright lesion at the right side of the brain MRI image, meaning that the patient has glioblastoma at his left side of the brain. So the glioblastoma appears bright or hyperintense due to high water content of the tumor. Next, we also can see from the image that surrounding the lesion, there is hyperintensity as well, indicating that there's an extensive edema surrounding the glioblastoma. Other than that, the lesion also causes some distortion of some structures of the brain, like you can see in the image. There is a compression of lateral ventricle at the affected side of the brain. And since we can see that there is no hypointensity shown around the glioblastoma, we can say that there is no necrosis occurs yet, indicates that this patient may still be on early stage of the tumor.
Hi and Assalamualaikum, my name is BINTI and in this video I will be explaining on the coronal view of glioblastoma in MRI. So this is an image of 3D T1 weighted of MRI, and this is a coronal section of the brain at the level of pituitary gland. So before we dive in deeper, let's take a look at the label image given. So from the top we have superior sagittal sinus, grey matter, white matter, lateral ventricle, septum pellucidum, putamen, globus pilatus, third ventricle, temporal lobe and spinal sinus, and on the left side we have cingulate gyrus, corpus callosum, choroidal nucleus, column of pharynx, anterior commissure, preoptic area, optic tract, tuber cinereum, internal carotid artery, and nasopharynx. So as you can see, the glioblastoma is located at the superior aspect of the left frontal lobe. And in T1 weighted images, the glioblastoma is typically appear hypointense relative to a normal brain tissue due to their higher water content, necrosis, and edema. Moreover, the surrounding of the glioblastoma is neither dark nor bright but rather greyish appearance due to the presence of edema often changes the tissue characteristics of the surrounding brain. And this grey one is a mix of normal brain tissue and fluid-filled space around the tumor.
This is sagittal view in MRI for glioblastoma. Figure 6 shown a sagittal T2 weighted MRI image of glioblastoma in the red arrow. In this image, it shows 17 mm in diameter of lesion at the occipital lobe. The lesion exhibited clear edges and homogeneous thickness in the cavity in addition to peritumoral edema. For the labeling, we start from the right bottom, which is the spinal cord, then tongue, midbrain, temporal lobe, eyeball, insular arteries, frontal lobe, gyrus, body of corpus callosum, occipital lobe, transverse sinus, cerebellum, cerebral vermis, fourth ventricle, and last but not least is cisterna magna. The lesion in T2 weighted MRI appeared hyperintense, which is bright in the image because glioblastoma have high water content. The T2 weighted MRI imaging is suitable in detecting glioblastoma because it can differentiate water content with other tissues. Next, the T2 weighted MRI can aid in highlighting the age of the glioblastoma, which is very beneficial in guiding treatment decisions. Hence, T2 weighted MRI image gives enhanced contrast resolution than T1 weighted MRI image by the ability to differentiate the tumor tissue from normal brain tissue.
To conclude, glioblastoma is a primary brain cancer that occurs most common in adults in the cerebral hemispheres. It also shows signs such as high blood pressure, while symptoms such as seizure that can affect one's daily life. The abnormal findings such as large hypodense lesion can be seen clearly in axial, coronal, and sagittal plane for both CT and MRI to diagnose the glioblastoma. So that's all from us. Thank you.